Hi all, today we will be seeing some of the important cephalometric landmarks used for cephalometric analysis in orthodontics. A lateral cephalogram is a side view of the skull which shows the orientation of the upper and lower jaws and the teeth oriented in them. It is commonly used for routine diagnosis in orthodontics. Some of the landmarks are anatomic, that is, they represent the actual anatomic structures, and some are derived from the anatomic structures. The first landmark will be nasion, which is the most anterior point of the frontonasal suture in the midline. Next is the sella point, which is termed as S, and it is the midpoint in the hypophyseal fossa. The next point will be point A, and it is the deepest point in the midline between anterior nasal spine and the central incisors in the curvature. It is also known as subspinal. And point B is the deepest point in the midline between alveolar crest of mandible and mental process, that is the chin, also known as supramentale. Next is pogonion. It is the most anterior point of the bony chin and seen from the midline, the median plane. And the next point will be gnathion, and it is the anterior and inferior point in the chin, anteroinferior point in the chin. Next will be your gonion, which is seen in the angle of the mandible. It is a constructed point, that is intersection of the ascending part of ramus and the mandibular base. When the tangent is drawn, the point of intersection. Next will be menton. It is the most inferior point in the mandibular symphysis. In the chin, the inferior most part is called menton. Next, condylion is the postero-superior point on the head of the condyle. It is seen in the condyle region, that is condylion. The next point will be porion, and it is the bony point in the external auditory meatus, the upper margin. It is seen in the upper margin, that is called porion. Next point will be orbitale. It is seen in the orbit. The lowermost point in the orbit is called orbitale. The next will be ANS. The point ANS is anterior nasal spine, so it is the tip of the anterior nasal spine in the midline, and it forms the anterior part in the palatal plane, and the posterior nasal spine is the distal limit of the maxilla, the palate. So this forms the ANS and PNS. Thank you.